Vitamin B12 is important for the synthesis of DNA and the creation of red blood cells. Unfortunately, since our body is unable to produce vitamin B12 on its own, we must obtain it from foods like chicken, eggs, and beef, as well as supplements. However, as we age, our body's capacity to absorb vitamin B12 decreases, and statistics show that up to 20% of people over 60 in the United States and the UK are vitamin B12 deficient. Sadly, B12 deficiency is frequently disregarded, but not today, as we will discuss the typical signs of B12 deficiency. Before we start, please don't forget to give this video a thumbs up, subscribe to our channel, and share it with your family and friends. Number 1. Fatigue. If you get at least 7 hours of sleep every night but still feel exhausted, your body may be deficient in vitamin B12. And this is not the normal form of tiredness, because low vitamin B12 levels might impair cognitive function and concentration. You should check your levels. Without vitamin B12, your body's cells cannot operate normally, which causes a decline in the generation of regular red blood cells and poor oxygen delivery. You'll feel weak, fatigued, and disoriented if your body does not have enough red blood cells to transport oxygen to tissues. Studies have shown that vitamin B12 pills can considerably increase energy levels if you have a shortage. So, if you have trouble getting out of bed in the morning, you may want to stock up on these vital B vitamins. Number 2. Tingling and prickling sensation in the hands and feet. Because it aids in the synthesis of myelin, a material that covers the neurons and facilitates the transmission of feelings throughout the body, vitamin B12 is essential for the health of our nervous system. Because of this, people who are vitamin B12 deficient, especially older people, may have tingling sensations in their hands and feet as a result of peripheral nerve damage. This is because its absence can cause nerve conduction problems or possibly nerve damage. Number 3. Blurred vision. Your optic nerves may be affected by a severe B12 deficiency, which can cause visual blur. Before buying a new pair of glasses, you may want to get your vision and vitamin B12 levels examined. Also, remember to take your vitamins. You may believe that you need glasses when in fact, you need a healthy dose of vitamin B12 supplements. Number 4. Depression. One common cause of depression, which is a serious illness sometimes ignored, is a vitamin B12 deficiency during infancy, pregnancy, and childhood. Because vitamin B12 is essential for the growth of our brains and cognitive abilities, pregnant women should take multivitamin supplements rich in B12 and folate. According to research, infants who are vitamin B12 deficient are more likely to experience depression as adults. Of all, there are many other causes of depression, including psychological stress, so you shouldn't ignore diet either. Eat properly and be cheerful. Number 5. Yellowish skin. A lack of vitamin B12 can result in jaundice. It's a pigmentation of the skin and the whites of the eyes that is yellow or green and is brought on by excessive amounts of bilirubin. Bilirubin is a waste product produced when your body breaks down red blood cells. There are less completely developed, healthy red blood cells when there is a vitamin B12 deficiency. When jaundice takes control, your skin will typically be pale and have a yellowish tint. Number 6. Movement issues. Keep in mind that vitamin B12 deficiency might harm the peripheral nerves. However, such damage can make it difficult to move around or even run or walk. That's correct. Your feet and limbs may become numb, weak, and unable to support the weight of your body if you have a severe vitamin B12 deficiency. Your reflexes may be impacted as well. Take your vitamins. Consume low-fat milk, yogurt, cheese, beef, liver, chicken, and fish. Number 7. No strength in the muscles. Well, if you feel your muscles are weak, Going to the gym might not always help because, like pretty much everything else in our bodies, your muscles need oxygen to stay strong. Red blood cells carry oxygen to your muscles, and because they need vitamin B12 to synthesize, your muscles may also feel weak if you are deficient in vitamin B12. Number 8. Memory loss. The body's capacity to absorb vitamin B12 declines with age. According to studies, dementia and memory loss in the elderly might result from prolonged B12 insufficiency. However, there isn't enough proof yet to show that vitamin B12 is beneficial for people who are already dealing with memory loss. So get some now, just to be safe. Low stomach acid, Crohn's disease, digestive system surgery, and other diseases can all affect how well vitamin B12 is being absorbed. Therefore, be sure to monitor your vitamin B12 levels, eat the correct foods, and maintain active, healthy life. Number 9. Headaches. If you don't have enough vitamin B12 in your body, you could suffer from vitamin B12 insufficiency. The most frequent neurological adverse effects may appear to be headaches. According to research, both in adults and children, headaches are the most typical signs of vitamin B12 deficiency. Research shows that patients with recurrent headache complaints are more likely to report low B12 levels. Number 10. Irregular heartbeat. Tachycardia, or simply known as rapid heartbeat, can be brought on by a B12 deficiency. Low levels of vitamin B12 can cause a megaloblastic anemia, which in turn can cause loss of appetite, fatigue, and palpitations of the heart. Heart palpitations are characterized by an irregular heartbeat, which makes you feel uncomfortable and even trigger a panic attack. Because anemia can be brought on by vitamin B12 deficiency, low levels of vitamin B12 might damage your heart muscles. Now that you know the common symptoms of vitamin B12 deficiency, always make sure to take your supplements and eat foods rich in vitamin B12. The information contained in this video is not intended to be a substitute for professional medical advice. If you have any concerns about a certain medical conditions, please consult your doctor. If you think you learned something from this video, please hit the like button and subscribe to our channel. Thank you for watching.